Hello and welcome to Nootropics. In this video, I'm going to explain acute and chronic bronchitis. I'll start firstly from acute bronchitis. Acute bronchitis is defined as an inflammation of the mucous membrane of the tracheobronchial tree. Acute bronchitis affects 40 per thousand adults each year in the United Kingdom. It is the fifth most common disease diagnosed in patients with cough. The disease occurs most commonly during the winter months and is associated with infections caused by various etiological factors as follows. The etiological factors of acute bronchitis include viral, bacterial, physical, and chemical agents. Viral agents include influenza virus, rhinovirus, adenovirus, and even coronavirus. Bacterial agents include staphylococci, streptococci, Bacillus fever, Mycoplasma pneumoniae, Chlamydia pneumoniae, and Bordetella pertussis. Physical and chemical irritants include dust, cold, and smoking. The inflammation starts usually after infection by a viral or a bacterial agent. The inflammatory process starts after the causative agent reaches the mucous membranes of the nasopharynx, trachea, bronchi, and sometimes the bronchioles, leading to lesion or degeneration of these membranes. Inflammation in the bronchial mucosa leads to increased secretion of viscous mucus, edema, and bronchospasm. Symptoms of acute bronchitis include a dry cough, which after 2 or 3 days turns into wet cough after the discharge of sputum. Other symptoms which usually appear in acute bronchitis include fatigue, fever, headache, and dizziness. In addition to that, sore throat, pain, and heaviness behind the sternum are detected. In acute bronchitis, harsh sound is detected in respiration, with the dry rales detected in all pulmonary parts. For the diagnosis of acute bronchitis, complete blood count is made, in which detected leukocytosis and elevated ESR. In the sputum study, polymorphonuclear leukocytes are detected. X-ray diagnosis also can be made. The treatment strategy includes etiological therapy, pathogenetic, and symptomatic therapy. For the etiological therapy, antiviral and antibacterial medications are used. In pathogenetic therapy, bronchodilators, expectorants, and mucolytics are administered. Symptomatic treatment, antipyretic are administered in order to treat the temperature, and also non-steroidal anti-inflammatory drugs are administered. Chronic bronchitis is defined as a chronic obstructive inflammation of the mucous membrane of the bronchi, characterized by progressive lesion and relapsing periods, with obstruction of the respiratory airways, which causes the lumen to be narrow, and that causes dyspnea, wheezing sound in respiration, and excess production of mucus. Lesions of the bronchi are manifested in sputum expectoration in total period of 3 months within 2 years in a row. The main difference in etiology of chronic and acute bronchitis is that chronic bronchitis is caused by long-term exposure of irritants. Inhalation of irritants such as tobacco, dust, toxins, gases, coil, and others, which are the key factor in the development of chronic bronchitis. I'd like to mention that cigarette smoking is the leading cause of the development of COPD diseases, bronchitis, and emphysema. Pathology of the nasopharynx, respiratory viral diseases, and acute bronchitis can be etiological factor for the development of chronic bronchitis. Also, left side heart failure can be a cause for the development of chronic bronchitis due to stagnation of blood in the lungs. The long-term exposure to irritants makes the irritants reside in the mucosa of the bronchi, with the try of the ciliated epithelium and mucosal glands to remove them. The epithelium and mucosal glands become hypertrophied, and that causes increased production of mucus and thickening of the bronchial lumen. This situation causes the development of the obstructive syndrome. Air movement in the small bronchi becomes obstructed, which causes difficulty of breath. In chronic bronchitis, ventilation is very much reduced, and that leads to abnormal ventilation-perfusion ratio, and patients usually suffer from hypoxemia, which is manifested with cyanosis and acidosis, which causes eventually pulmonary hypertension and right heart failure. The clinical features of chronic bronchitis include cough, which is the main symptom. Cough occurs for a period of 3 months in total within 2 years in a row. Cough occurs mainly in the morning and is accompanied by sputum expectoration. Dyspnea occurs due to obstruction of the bronchial lumen and also due to increased production of sputum. In the exacerbation period, the following symptoms are noticed: high body temperature, sweating, general weakness, and decreased ability to do work. Objectively, on auscultation, harsh respiration sound with wheezing and buzzing rails. In long-term course of the disease, dyspnea, swollen jugular veins, cyanosis are noticed. Usually, chronic bronchitis is diagnosed mainly by the clinical symptoms. In addition to that, complete blood count can be made, in which high ESR and leukocytosis are detected. X-ray study can be made, in which detected pulmonary fibrosis. Pfeiffer index is below 70%. Maximal ventilation rate is below 85%. For the treatment of chronic bronchitis, antibiotics are administered, and also bronchodilators, mucolytics, and expectorants as a pathogenic therapy.